But first, a GP surgery in West Shepton is joining with 4 others in Somerset to create the Mendip Primary Care Network.
Grove House Surgery will work with the Beckington Family Practice, Mendip Country Practice, Park Medical Practice and Oak Hill Surgery, covering a population of over 32,000 patients.
It's part of a national scheme encouraging surgeries to work together and share resources. Ellie Barker has been to Grove House Surgery to see what the changes will mean for staff and patients.
It's a small, idyllic-looking surgery in a quiet part of the Mendips in West Shepton, but inside it's anything but quiet. While we were filming, Sue Dampier, the receptionist, greeted around 30 people every hour. Her shift is nearly 12 hours long and she works mainly alone.
It's just continuous booking people in, answering their queries, just generally making sure the whole front office is being run smoothly.
Here in the central and east Mendips, it has one of the oldest populations in the country, as well as a recent increase of young families moving to the area. Over the next 5 years, all the surgeries will stay in their locations, but the overall organisation will be shared.
They're going to think straight away, this is all about cuts. What would you say to those people who would be worried?
I'd say this is certainly not about cuts. In fact, it's actually the opposite. So over the 5 years, through this scheme, we will be able to employ additional staff.
But the question is, what does this mean for you when you call up your GP from home? Well, the idea is you'll be able to access out-of-hours appointments across all 5 different surgeries where they'll be able to get into your notes. And also, you'll be able to see different members of staff like physiotherapists and paramedics. But then, doesn't this mean even more pressure on staff? The answer here, they say, is no. Less time will be spent on administration and out-of-hours sessions will be shared.
I think this will make it much more attractive for GPs, particularly in a way that they can see GP surgeries working collaboratively.
Just up the road in Town Street, opinions are mixed.
It may be easy to access somewhere, but it depends how far you have to travel.
What I would like is to be able to see the same doctor regularly. It doesn't sound like this is going to be making a great deal of difference to that.
Sometimes you phone up, you can't be seen for 2-3 weeks. So, yeah, hopefully, if it works, then it should serve everybody a lot better in the local area.
They say the new service will mean more house visits for their older patients, keeping them at home and away from germs. Opinions will be made clear over the coming months, but for now, staff believe a brighter future could be on its way. Ellie Barker, ITV News.